Good afternoon, everyone. Like you mentioned, I'm Dr. Kleinguetl, or however you want to pronounce it. Basically, they wanted me to just give a quick talk on some a little more difficult patients that we tend to see almost every day in practice. So to begin, I don't have any disclosures, but the two I briefly decided to talk about was kidney stones and the kidney stone management during pregnancy. As some of our other staff over at Wake Forest will notice, this is kind of like a pared down version with a little bit less of the scientific research behind it, and then kidney stone management in patients that are having recurrent urinary tract infections. So the importance of the kidney stones in pregnancy, we've all probably seen them, and many of our residents will also realize that when they come on in, that's usually the consult that you get that kind of makes you get a little bit more nervous, a little more sweaty, because we don't usually deal with them all the time. But the reason that this is very important is just because of the increasing prevalence of kidney stones, and then especially in the setting of pregnancy, with the risk of having recurrent urinary tract infections during pregnancy associated with those stones, or increased risk of premature contractions, premature delivery, or patients that are having those recurrent urinary tract infections end up having can have recurrent miscarriages as well. So it can be a difficult population, one that is very important to be able to treat appropriately. So where I always like to start with this is going to be the imaging, and as most people know, the big workhorse for imaging is always going to be our renal ultrasound. Depending on where you are, though, it is very important to